Welcome and thank you for attending this Facebook Live event from the 2019 American Dairy Science Annual Meeting. Each year, ADSA brings together top researchers from all around the world that focus in dairy research. And we couldn't think of a better venue to share some research we conducted with Dr. Jim Drackley and his colleagues there at the University of Illinois. Joining me today for this panel discussion is Dr. Jim Drackley, who's a professor of animal science at the University of Illinois, and my colleague, Dr. Kristen Glosson, who is a dairy technology manager for Phibro Animal Health today, Phibro Animal Health Corporation. And the work that we're going to present today was part of her dissertation work under the guidance of Dr. Drackley. And for those of you who don't know me, my name is Ken Zanzalari. I'm Animate Product Director for Phibro Animal Health Corporation. So with those introductions, I'm going to turn the program over to Nancy Hallahan from the Brighton Agency, who will be acting as our moderator for today's panel discussion.
Thank you, Dr. Zanzalari. And for those of you watching today, our panelists will share takeaways from a recent dairy research study, as well as key takeaways for calcium intake. For those of you joining us virtually, you'll see an email address at the end where you can send your questions. The team will follow up with you directly in days to come. Let's begin. Dr. Drackley, what was your reasoning for conducting this study? What need did you see in our knowledge of prepartum DCAD and calcium metabolism that this study might help address?
We've been working for many years on the idea of controlled energy dry cow rations, which is a strategy that we think works very well to control health problems during the transition into lactation. And we've learned a lot of things about that program, about how to make up the energy, amino acid supplementation or protein supplementation. But the one thing that we really didn't know much about was what to do with calcium metabolism and control of calcium after calving. And for many years, we've just been going with the partial acidification approach, which seems to work very well in the field to minimize milk fever occurrence, but really doesn't get at the issue of subclinical hypocalcemia. So that was one of our major interests going in. And then the second reason probably was the general confusion about calcium levels in prepartum rations.
Thank you. Dr. Zanzalari, what was Phibro's interest in conducting this study alongside Dr. Drackley?
As Dr. Drackley already pointed out, controlled energy diets are a mainstay in feeding dry cows globally. And that strategy is also applied to feeding of prepartum cows. So it was a special interest to us to see how various or commonly fed acidogenic strategies would fit within the controlled energy strategy. So we worked with Dr. Drackley to investigate three commonly fed DCAD strategies. The control diet was a diet that was non-acidogenic with low dietary calcium, 0.4% dietary calcium. The second treatment in that study was a fully acidogenic diet with low dietary calcium, same dietary calcium as the control diet, which was 0.4%. And then the third strategy was a fully acidogenic diet with high dietary calcium. And that dietary calcium level was 2%. And so a couple of key points there. When we use the term fully acidogenic diet, I'd like the audience to understand that in our terms, we mean cows that are put into a state of compensated metabolic acidosis that results in urine pHs between 5.5 and 6. Okay? That's fully acidogenic. And then the high dietary calcium at 2%, may seem foreign to a few people, but the more people you talk to, you'll see that higher and higher levels of dietary calcium are being fed under any one of those three strategies. So it was really important for us to conduct this study to help discern what some of those differences may be in cow responses.
Thank you. Dr. Glosson, I understand that this work was part of your PhD dissertation. What 2 or 3 critical things did you learn while conducting it?
So a couple critical things from this study I think really revolve around calcium. So the purpose of a negative DCAD diet is to create this calcium flux. So you start calcium mobilization from the bone, you increase calcium absorption through the digestive system. And what that does is, when that's happening prepartum, at the time of calving, that calcium will then be available for the cow when she begins lactation. And so what we did with this study is we looked at the calcium status of these cows postpartum in two different ways. The first one being the serum total calcium. And we found that our two fully acidified acidogenic diets had improved calcium status measured in this way at 48 hours after calving. And the reason why this is so important is that this technology is available to producers out in the industry. So they can take samples from their cows at or directly after calving in order to test the DCAD strategies that they're using in the prepartum period. Then in the academic world, we also looked at ionized calcium. So that's the available fraction of calcium to measure the calcium status of the cow. And unfortunately, it's hard to use this in the industry because you have to analyze these samples within 10 minutes after taking them. But this available fraction of calcium in the blood is what the animal is actually able to use. So what we found in this study is that those two fully acidified diets also had improved calcium status using ionized calcium. So both of these methods agreed with the fact that the fully acidified prepartum diet was able to improve calcium status after calving. And of course, calcium is so important in many different functions besides milk production. The immune system, smooth muscle contraction, like the digestive system. So then that can be connected to production and health benefits.
Thank you. Dr. Drackley, what do you believe was the most significant finding?
I think there's several important findings, both from a scientific standpoint in the controlled study, but also kind of internal to our own body of research over the years. So I think the effects on intake during the pre-calving period were very interesting. We had a small decrease of intake with the acidogenic diet with the low calcium, but about half of that decrease was taken away or alleviated by having the high calcium. So I think it surprised many people that we had such good intakes with that large an amount of calcium along with the DCAD diet. And again, the second point would be just the various measures that we had of understanding how these diets affected the cows differently. And the whole idea of increasing the flux of calcium before calving to prepare the cow for post-calving has been well known, but I think we were able to document that pretty clearly with our study and show that there was perhaps even a slightly additive effect of having the greater calcium. And I think internally for us, again, after years of working in this area, one of the criticisms or questions that we often got was that our intakes after calving sometimes seem to be low with that type of diet, the controlled energy, and would controlling the calcium using a negative DCAD program help that intake. And it certainly resulted in a better result for us relative to previous studies, which is not, we can't make that comparison directly across studies, but just internally, to me, it was somewhat of an eye-opener to see the benefits since we had not worked with the acidogenic programs earlier.
Dr. Glosson, same question. What was your most significant finding?
Dr. Drackley answered it so well. I would say mine, outside of the anecdotal observation that these cows were definitely healthier than I had seen them before, we measured health using an adverse health score. The formula comes out of the University of Georgia. And in these types of studies, it's very difficult to measure health results, at least statistically. And so what we did was, using this adverse health score where we assigned an economic impact to different health disorders from 1 to 5, so 5 being the most economic impact and 1 being, well, technically 0 being the least economic impact if the cow didn't experience any disorder, each cow was then given a score. So if they had multiple disorders, that score was even higher. And so this allowed us to actually run this through statistics and allowed us to compare them across treatments. And what we found was, even though we couldn't piece out differences or statistical differences in the actual individual health disorder, when we assigned this adverse health score, we found that our fully acidified diets did have and decreased adverse health score compared to that positive DCAD diet.
Great. Dr. Zanzalari, how important were the findings of this study to supporting the dairy industry's knowledge of using prepartum acidogenic rations for controlling hypocalcemia?
Our knowledge of hypocalcemia and calcium metabolism is fairly extensive. I won't say it's complete. And while there's a lot of good work, unfortunately, I think what has led to the conversations we have surrounding hypocalcemia and hypocalcemia management gets back to how the different studies investigated hypocalcemia. As an example, study designs were different. Dietary feeding regimes were different. As an example, one study may have partially acidified cows. Another study may have fully acidified cows. They may have used different magnesium levels, different calcium levels. And so while that's good for our general knowledge, I think it's left a lot of people confused and wondering, what is the most appropriate strategies. They all have their benefits, but from our standpoint, from a Phibro Animal Health Corporation standpoint, we believe that a fully acidogenic diet with high calcium will lend to the best possible outcome for a cow. So from my standpoint, this study really reinforced what our program is all about, and that's substantiating that cows can be fed fully acidogenic, high calcium diets and perform very well.
Thank you. Dr. Glosson, you're now out of school and working in the dairy industry. How did conducting this study help prepare you for your role as a dairy technology manager?
I think that's a very complicated question. So I would say the thing that I love about my current job as a dairy technology manager would be my interaction with both producers and my interactions and participation in research. So I see producers asking questions, and I see research as a way to find the answers. So there's a pool of knowledge that's available, but a producer needs the answer to their specific question. So I'm able to take some of that research and help the producer use it in an applicable way to help their cows, to help their dairy. But at the same time, since Phibro is such a science-based company, I'm able to take the questions from the producers and work them into the research that we're involved in. For this specific study, I found that the major conversation in the dairy industry I've been involved in so far is about prevention. And this entire study revolves around preventing those cows from getting sick. We want them to be as healthy as possible. Producers don't want to have any sick animals on their farm, so it's very much a focus on giving them the foundation that they need and supporting that immune system, supporting that animal and her ability to transition from prepartum to postpartum, from gestation to lactation in the easiest and most stress-free possible way.
Dr. Drackley, how have the findings of this study changed your recommendations for feeding a prepartum DCAD?
I think in many ways this study was an eye-opener for me because, first of all, as I mentioned earlier, we didn't really have any good basis to make recommendations. One of the perceived benefits of the controlled energy approach during the dry cow program was that we didn't have to use acidification, which made things easier at the farm level, perhaps. And again, there was just no real data to argue otherwise. For me, to see the benefits of following a strict, fully acidified program in terms of how the cows transition was quite revealing, and I certainly now have changed my thinking to support the use of a well-implemented program. I think that one of the problems that Ken mentioned, the variability in all the studies that have been conducted over the years, but in addition to that, in the field we've seen drift over the years, that when the idea of negative DCAD programs came out, the science was strong and the results in the field were strong if the programs followed. But over time, things drift on the farm, and we get away from a strict discipline of implementing that program. And farmers, like nutritionists, tend to want to do things their own way and think that, well, maybe this part of the program is not as important, and it would save me labor if I don't do that, so I'm not going to do it. So I think that just kind of bringing back to the industry that the concepts are very strong scientifically, and when the program is implemented, the results are very good. So I think it has changed my recommendation. Our study, along with the study that was previously conducted at Cornell, I think have laid out some very nice basis for recommendations to producers and to the people that are working with them.
Dr. Zanzalari, from your standpoint, what were the most critical findings of this study?
For me, there are two. The most important, and Dr. Drackley alluded to this just a moment ago, was what we observed in calcium flux between cows fed the fully acidogenic high calcium diet and the other two diets. So in this study, cows that were fed the fully acidogenic diet with high dietary calcium had a greater calcium flux compared to the other two treatments. So that was one. And let me take a minute just to briefly explain calcium flux for people in the audience that may not fully understand that. In simple terms, the flux of a nutrient is just the transfer or exchange of a nutrient either across a tissue bed, an organ, or a compartment. And so how we measured calcium flux in this study was indirectly through looking at urinary calcium excretion. And what we found was, point number one, the fully acidogenic diets, both of them, greatly enhanced calcium excretion through the kidney and out through the urine. And what surprised us a little bit, and what was a new finding for us in this study, was that when we fed higher levels of dietary calcium under a fully acidogenic strategy, there was even a greater flux of calcium above and beyond the cows that were fed the fully acidogenic diet with low dietary calcium. And again, some of that information is not new. We know, and Dr. Drackley mentioned the Cornell study, we know, and through various other work, that acidogenic diets increase urinary calcium excretion. That was not new to us, but this study, and one of the reasons we conducted it, is we wanted to find out, was there a dietary calcium effect as well? And this study really teased that out. So the cows that were fed the fully acidogenic high calcium diet excreted about over 11 grams of calcium. And the cows fed the fully acidogenic with low dietary calcium excreted 9 grams. So that was the main key point. The other one that I would suggest is a fairly important one, is that when we looked at dry matter intake of the cows fed the fully acidogenic diet and high dietary calcium, they weren't quite equal, but they were very close to the control cows. I think as a percent of body weight, the cows that were fed the control diet, a non-DCAD diet, ate about 1.5% of their body weight, which was very good. And the cows fed the fully acidogenic diet with high dietary calcium ate about 1.47%. So very similar. And I think it's just a common thought that if you feed an acidogenic diet, you have to work around, or you have to compromise dry matter intake. And that's not always true. And again, going back to what I alluded to earlier in another answer of mine, when you look at the data across many studies, there's diets that can severely affect dry matter intake in these prepartum cows. And it becomes a compromise of whether you want to implement a diet like that. And one of the benefits, I think, of feeding a program that we suggest is, while we may see a slight decrease in dry matter intake, it's not very significant. So those are the two key points that I take home from this study.
Thank you. And that concludes our Q&A. But before we wrap, do any of our panelists have any final thoughts to share?
I'm fine.
If not, then Dr. Zanzalari, what key takeaways do you want our audience to remember from this discussion?
I think the three things, and I think we've all pointed to each of these, were, Kristen alluded to the reduction in adverse health score. That's an economically weighted index, and for the reasons she explained, was an important finding. The cows fed the fully acidogenic diet with high dietary calcium had a significantly lower health score. And if you could keep a cow healthy, things go very well on the farm, including enhanced milk yield. The second one goes back to the calcium flux. Because the size of the exchangeable calcium pool within a cow can't be expanded, there's about 11 grams of calcium found within the blood and interstitial fluid compartment. And we know through good work that we can't really expand that to, say, 20 or 30 grams. It would be great if we could. So the only way around making calcium more available to the cow is to increase the turnover rate of that pool, and that's what we observed with the fully acidogenic and high calcium diet. And then the other one was only the minor depression in dry matter intake. So those are the three that I would point to.
Thank you for summarizing. And that concludes our panel discussion. This event will be posted to the Phibro Facebook page and available for download in July. So thank you to our panelists, and thank you to our attendees. And if you have questions, please post them to the Phibro Facebook page or email them to one of the email addresses you see. One of the Phibro dairy nutritionists will get back to you personally in days to come. Thank you.